Hello, everyone, and welcome to my podcast, Don't Get a Therapist Yet. And today I am honored to have a very special guest. Her name is Dr. Monika Wieliczkovideo, and she is a clinical psychologist. A warm welcome to you, Monika. Monika, can we start by you telling us a little bit more about yourself, if you wouldn't mind?
Of course. Hello, Wendy. It's
Yeah.
lovely to speak to you. Yes, my name is Dr. Monika Wieliczko. I am a clinical psychologist, and I specialize working with grief, especially with those forms of grief that get a bit complicated. And I developed this practice called A Guide to Afterlife, which focuses on supporting people on their grief journey. So it's a therapeutic community that supports people who maybe feel a bit social isolated, don't know how to exist in this world where grief sometimes feels like a very alienating experience. And I offer psychological therapy. I'm also developing an online course that supports people on their grief journey, as well as psychotherapy retreats. So I'm very much passionate about supporting our community and getting a bit more of that psychological understanding and how that can facilitate our grieving process, especially when things get a bit more difficult. So I've worked with, in the past, I've also worked with complex trauma when things kind of get a bit problematic in life. So worked in for NHS for many years, and the past few years I've decided to fully establish myself in private practice, supporting people who, struggle with complex grief experiences.
Thank you so much. And what an amazing amount of experience you have. And I think it's such an important subject that resonates to
Yes.
so many people. So thank you so much for giving us your expertise on this subject. And I just want
My
to
pleasure.
start by, yeah, you're very welcome. Um, I think there's a couple of words that people use, and sometimes perhaps understanding a little more in depth what the difference is between them. So, could you tell us a little bit more about the difference between grief, loss, and bereavement, Monika? If we could start.
Mm. Yes. So we think of loss as a more kind of generic term, which describes a period of time or an event during which something significant is being lost. So it could be a loss of job or loss of relationship because the relationship breaks down. It could be a life transition, just a natural part of life, when you move from one stage of your life to another. That involves progression, but it also involves a certain level of loss. And we all experience that. Loss is a part of life. But there are certain losses that are natural to us, like, for example, life related experiences, like we just mentioned. For example, if we um, get a new job, we lose our friendships very often. We might change career, we might lose our identity, we have to build again. Or later on in life, when we lose health due to prolonged illness or long-term condition. These are all kind of transitions that require us being confronted with a certain level of loss. So that's what we normally kind of define it as a life transition, and that requires certain level of adaptation. And then there are kind of more specific experiences, forms of losses. For example, death, when we lose someone very dear to us. We often end up reaching this state of grief, which is defined, I think loosely we can think of it as a response to the loss of a person. So grief is a very complicated, very multifaceted process where our body responds in a very kind of striking and concrete ways, usually by changes in the way our different organs of our body function. So it could be, a kind of like a very unpleasant experience of our heart racing, our mind getting really foggy. There's a lot of kind of evidence that suggests that everyone has a very unique way of grieving and experiencing loss of a loved one. But there are certain things that are very kind of almost universal for everyone, and it could be difficulty with sleeping, it could be difficulty with eating, or eating too much and sleeping too much. So they're kind of more extreme ends of the spectrum with every kind of level of functioning that you can think of. We might be struggling to think clearly. So for example, ability to reason, to make decisions can be quite disabled for a longer period of time. It could be several months, it could be a year, maybe a bit longer. And as someone who've experienced a significant loss myself, because I've lost, amongst other people, one of the most significant losses I've experienced was the loss of my husband several years ago. And so I can very much relate to what that really feels like. And what a tremendous kind of event that is in someone's life. And I feel really kind of almost like a bit shocked how little we talk about that in our society, and how little there's kind of good quality information about what grief really is about. So this is a really important question that we get right, which is, the bodily response to loss. Then you've got the psychological response to loss, which is all the emotional reactions, which could range from a despair, a sense of completely shattered hope or belief in life. Because when we lose someone very close to us, we're not just losing that individual, but we also lose our sense of safety, stability in life. Very often it shatters certain hopes and beliefs for the future. So the psychological response is huge. There's actually a lot of evidence that suggests that the way our brain function and the way we store this kind of map of the world is completely shattered. So in your internal world, you include the person who you've just lost, and you kind of relate to them in this very kind of tactile way. So they're always there. But when they die, suddenly there's this huge mismatch between what's happening for us internally, so how your brain, your mind stores the image of your life, of all those experiences you've had throughout the life, those kind of maybe they can call them like shortcuts that help us perceive world in a particular way. This is all completely changed. And that means we need to go through this process of grief that allows us to, I suppose, in some ways, adapt and find a new way of living without that person physically being present. It doesn't mean they're not present in our minds, because I think they always are. And part of the grieving process is around helping us preserve that person, but also being able to live. So in other ways, how we should put it is that when we're grieving, we are processing also all those changes that have taken place as a result of this person's death. And that also includes, our cognitive functions, emotional functions, physiological functions, but also relationships that are left, how they're changing your perception of the world, your society around you, what's important to you in life. So all these things are being worked through in the background as we grieve. So it's a massive, absolutely massive task, grief is. And there's obviously much more we can go into, but for now, I just wanted to also address the bereavement, which is, I think in society, we perceive bereavement as that period of time after someone dies that is in some ways socially prescribed as the time when we are withdrawing from social activities, when we are going through our grief process, but in a very kind of, I often think of it as slightly automatic process. I don't know how to describe it in a kind of more clear way, but it's something about completing a task that involves coming to terms with someone's loss. But it's often seen as a period of time that maybe takes several months or up to a year, and after which there's an expectation that someone comes back to normal life, as if they get over their grief, which is incredibly problematic from the point of view of an individual who's going through a massive life transition, such as a significant loss of a loved one. So I feel extremely passionate about talking about this subject because there's just so much we still need to know and educate people about how to experience, well, how to allow themselves to experience grief, how to make room for grief alongside their lives. Because for me, grief is an experience, it's a part of life, not something that has a some kind of time frame. Is something that constantly evolves, something that changes as we change, because that's the nature of any relationship. Just because someone dies doesn't mean that they suddenly cease to exist in our minds. They do. And it's extremely important that we allow this process to evolve. And that has its own challenges, its own kind of advantages, what it can give you if you actually lean into your grief, but also what happens when you don't let yourself experience those feelings. And that often can lead to more complicated forms of grief, which is something I feel really passionate about, and I really enjoy working with people who struggle with grief.
So thank you for that very comprehensive understanding of the differences, Monika. That's really, really fascinating and very, very interesting. And you talked a lot about the symptoms there. Is that most of the symptoms, or are there any other symptoms you wanted to mention?
Yeah. So kind of just explore that a bit more. So grief, as I said, it manifests in those different areas of our lives, in the body, in the mind, and I think if we look a little bit more into the way we think and the feelings we experience, what we often notice is the initial stage of grief is when we get this kind of shock response, and that often is accompanied by a range of symptoms like increased heart rate, and a sense of panic when someone dies, because grief is such a fundamental experience in our life, because we are attached to people, and as our attachments gets ruptured when someone dies, it almost feels, often people refer to it as if someone very significant dies, is that they worried about their sense of stability in life gets completely shattered. It's as if they're about to die too. And I think that's really significant in understanding why we have such increased, response in the body physiologically, because our brain thinks in some ways that, this is life-threatening. And even though logically we know we're alive, but on some level, I think people often experience this incredible fear that their whole life is gone, that part of them died with the person. And it's very difficult to have a good sense of identity or knowing who we are when we're grieving. So it shatters just so many different aspects of not just your day-to-day functioning, which you often end up struggling with, especially initially. So it might be very hard to get out of bed and eat and kind of socialize with your friends and family members. Or you might be doing the opposite. You might be getting really busy, trying to get back to work really quickly after the bereavement and pretending like nothing happened, which is kind of this maybe more hyperactive way of responding to grief, and avoidance of the feelings that are deeply rooted in you, to do with the loss. So people respond in a very different way depending on their attachment style, how they were brought up, what the experience of loss was before, how their family dealt with loss, how much support they have. But those kind of initial stages, of grief are very much around trying to establish this basic sense of safety and not knowing how to return to some kind of routine. So often what we see is that people struggle to just have a sense of, kind of normality, of remembering how things used to be. They can't return to that state of normal functioning very easily. And as time progresses, I think you start noticing certain feelings coming up. So it could be, a lot of sadness and despair, rage, a sense of injustice, and life doesn't make any sense. How am I supposed to function like this when this closest person to me has died? That could also involve, all sorts of questions about, um, ourselves and the future, and questioning, what to do next in life and whether it's all worth living. Sometimes people feel quite suicidal, or they might wish that they died with a person who passed away. So there could be all sorts of very intense reactions, and these feelings, that's another thing, that initially those feelings are very, very intense, and they can be quite problematic in a way if we are not allowing ourselves to fully experience them. So what is really important at this stage is to have, a support system that helps you kind of think through all your feelings, your reactions, because sometimes people have very conflicting feelings, and I think that's also quite problematic. If you, for example, really miss the person who died, but you're also very angry that they died, and what do you do then? If you expect from yourself to only have those good feelings. So that's another kind of area that I often work with, that I think, often makes people feel really stuck if they just expect to have, I don't know, positive feelings. Or sometimes people struggle to think about the person who they've lost, because it's so upsetting. So they don't want to be feeling sad, so they avoid it. So there might be all sorts of kind of preoccupations with loss, or avoidance of thinking about their loss, and attempts to maybe sometimes, numb those feelings with alcohol or drugs, or sex, or all sorts of things that will stop them from feeling the pain. And the thing about that is, it's kind of quite normal for a period of time to be drinking a bit more, maybe needing to escape that feeling. But as time goes by, I think you generally, with healthy, more adaptive form of grief, what you notice is that you become a bit more in touch with those feelings. You work through them, whether that's through a support of someone else, or your community, or or a therapist. But you kind of work through those feelings, and and your relationships with the person who died begins to change. You notice that maybe those feelings are getting a bit less intense, or maybe you find yourself feeling a bit more at ease with the fact that they died, that you begin to talk about them in the past tense, as if they died, rather than, thinking that they're still alive. I think that's a big part of grieving process, is coming to terms, not making it look okay, like it's fine that they died, because I don't think no one ever gonna say, it's okay they died, I don't care about that. But the aim is to accept the fact that it did happen. And I think that's a massive step for anyone who's grieving. And for me, for example, it took about a year, where after I've kind of realized that, yeah, that he's gone, he really is gone. And that sense of permanence begins to take, more kind of, more kind of tactile form, like you begin to notice what's not there, as opposed to just longing for that contact with the person and hoping that one day they're going to come back. I think often people who are grieving say things like that, like, oh, it just feels like they can walk through the door anytime. I know it doesn't make sense, but it just feels like maybe they just, anytime it can happen. So it's part of us that's still holding on to that hope, that doesn't want to let go of the fact that this really actually did happen, and that we are in a different world without that person being physically present, but we're more kind of moving towards this person having space in our mind. So they're symbolically present in our mind because they've shaped us in many ways. Like everyone who's part of our lives had massive influence in how we are, how we live, how we function, how we think. And nurturing that side is incredibly important during that grieving process, which lasts for forever in some ways. I think many people would say that that never stops. It changes in its form and shape, and those feelings become less intense, and they might change as well. You might find yourself thinking about that person in more objective ways, and that's a big part of, I think, healthy grieving process, that you suddenly start to see them as a whole person with their own strengths and weaknesses, what we liked about them, what we didn't like about them, and how we missed them, but also maybe a bit of relief sometimes, especially if the relationship was complex, difficult in some ways. We start to make room for life. I think that's another kind of sign that grief is progressing well.
And Monica, again, you described the processes very well, and I'm sure lots of people can really relate to those comments that you made about the process. So it sounds though it's a bit like a journey that people go through. And could you tell us a little bit more about this idea of a journey?
Yeah. So I suppose you could think of it as a process that you embark on. And the moment that someone dies, it kind of sometimes feels like living in a parallel world. And I often think of it as, two parallel worlds living next to each other. The life how it used to be, or people who haven't been affected by your loss, or the old kind of path, or when people kind of move on with their lives, you kind of see this part of yourself, and you see this other path, which is your grief. And I suppose this journey evolves when we have those two very separate worlds in our minds, where you embark on this journey, you get quite upset about what happened, and the journey progresses when you begin to find a way to switch between those two different worlds, and you take maybe some time to grieve, and you think about the person who died a lot. That preoccupies your mind quite a lot, and you kind of might be going through different stories, different memories involving the person, how they were, and what you've experienced together, and kind of just remembering them. And there might be other times when you are thinking about life a bit more, and you kind of transition from the world of grief into the world of living, and kind of you start to perhaps become more invested in life. You get back into your routine a bit more, and you take a break from your grieving process. So initially it's very intense. It's all you can think about is your loss. In my case, all I could think of was my husband, and how he died, and all of that, replaying certain memories, replaying certain conversations, maybe looking through photos, and that becomes quite a preoccupation on a daily basis. And then as time progresses, you find yourself maybe that your emotional reactions becoming a bit less intense, and you find yourself being able to put that to one side, that grieving process. Doesn't mean that you're stopping grieving, but just kind of putting it away and kind of maybe leaning more towards your day-to-day life and starting to laugh, and someone says a joke or remembers something from the past, and you can kind of feel a bit more like a part of you that was a bit lost kind of comes to life again. And I think these are those moments when people sometimes feel very guilty that they shouldn't be really enjoying or laughing or having a nice time with their friends and family, or doing something that gives them pleasure. But paradoxically, that's what helps with your grieving process. So having that time away from grief is what actually fuels your ability to recover. So having this kind of experience of having a break actually allows your brain to function better, to process the past, to process the loss, and then you can come back to your grief when you feel like it, or whenever it comes back to you. And sometimes it happens very spontaneously. Just something reminds you of your loved one, and then you go that path. You follow that path. You start to think about them, and that brings a chain of memories and emotional reactions. So it comes in waves. So that journey often is very kind of complex in some ways. Some people find it quite taxing, exhausting, quite, in some ways, very uh, time consuming, because grief is really time consuming. But then you learn to live a bit, and I think that makes the whole experience a bit easier. But it brings its own challenges, like feeling guilty, feeling like worrying, or maybe I'm forgetting about this person. What does it mean if I'm allowing myself to, you know, engage in life or be infatuated by other relationships, or, especially when we lose someone at the same time when we gain, when, for example, when the baby's born or something very positive is happening in other people's lives that we are part of as well. So there's always this kind of tension between, are we grieving, are we living our lives? And I think the main task of grief is to allow you to integrate those two different paths. And how you do that, it's obviously a very individual process and it takes its time. Some people get there quicker, some people take their time. And eventually, I think you hopefully reach a place where it just feels more bearable. It's always hard, it's always difficult, but you've got those pockets of time and areas of your life that grows around your loss, and they become in some ways more significant. And that's just the nature of life, that we have to make that process. This process has to take place, otherwise we just end up feeling really trapped in this state of, like, a frozen state of grief, which stops us from living. So the task of grief is not to kind of stop us from living, is to allow us to take some time to get back to life and find another way of living without that person. So that involves often rediscovering ourselves, rediscovering our identity without that person, and what we've been able to gain from them, but also things that we're able to let go of. So it's a very complex journey, I think.
It is a very
Mm.
complex journey, but I like that metaphor use of actually being in two different worlds, because I think I can really relate to that. What my own experience is,
Mm.
how other people have said, is that you don't feel part of that world, do you? You've got your own
Yeah.
world going on. But I love
Mm.
that idea that gradually you are able to sort of reintroduce yourself to the world. So you've got more of a balance. That was a really good way of explaining that process, Monica. So thank you for that. You just started to
Mm.
mention the word complexity, and
Mm.
I think that might be another good topic to talk about, is how grief can be
Yeah.
really quite complex as well. Could you tell us a little bit more about that?
Yeah. So Yeah, so sometimes this natural process of grieving gets interrupted. And from my clinical experience, it's often when there's been a traumatic element of loss. So it doesn't have to be an actual experience of losing someone, but there might be also some trauma from the past that gets reactivated when we lose yet another person or something. We've lost someone significant in the past, and we haven't really worked through that loss, and then the new loss happens, and we just get, I suppose, confronted with the not just this current loss, but also the previous losses. So what I usually observe is when things get complex, it means that we are struggling to either think or process. So there's no movement in our grieving journey. We feel a bit stuck. This is often how people describe it to me, that they keep having the same images or the same kind of memories coming up over and over again, and they usually have a very distinct reaction to it. So sometimes people feel very guilty. They feel like maybe they should have done something to prevent the death, or they feel guilty about something they've done in the past that affected their relationship, and they can't forgive themselves. And I think in general, guilt is a massive problem in grief that sometimes we need a bit of help with understanding and processing. And it could also be that we're so traumatized by the experience, the circumstances, for example, of a sudden death, or if we witnessed someone's death, for example, that could have very catastrophic impact on us as individuals and our capacity to process that memory. And when this happens, then we cannot grieve. So we end up just reliving that experience over and over again. And that in itself is not a problem if it just happens for a period of time, because I think that's often what people would describe initially, that they just cannot shake it off. It just feels so overwhelming. There is an intense reaction of shock initially. But if after, I don't know, maybe 6 or 12 months, you still feel like this is not changing, it doesn't mean that we're expecting someone to stop grieving after 12 months. But if you feel that your intensity of your reactions or your thinking feels very trapped, you keep reliving the same thing and nothing's changing, you feel like you're back in the same room with them and it's happening over and over again, and that means that your normal grieving process got interrupted, usually by trauma or something from the past. Sometimes our attachment system gets activated and makes it very hard for us to be able to process what happened by ourselves. And that's usually when we need a bit more of support in dealing with that traumatic element. And what I often see in my clinic working with my patients is that once we process enough of that traumatic element, there's usually a natural capacity in all of us to just process our grief in a more kind of natural, healthy way, because our brain has an amazing capacity to deal with trauma. And in most cases, I would say that majority of people are able to return to living after loss. It's maybe, I don't know, maybe 30% of people, maybe less, who actually need that help. But it's usually in the context of what kind of loss they've experienced, how significant it was, the circumstances of loss, previous experiences of loss, and our personality, the support system we have around us. So all these things will be influencing in many ways how we deal with our loss, with our grieving process. And I think that's when you find yourself, there's actually, there are actually things we can do to help that process, which I think often is the biggest problem, is that when someone doesn't know that they're experiencing that feeling of being stuck in their grieving process, because naturally only the nature of our grief is that initially you feel quite stuck. So I don't want to kind of make people feel as if, oh, they feel stuck. It means that they've got complicated grief or something that requires attention. It's more the concept of time and how things change over longer periods of time. And I think that's even more important than anything else, is whether you see that transition or not, whether it feels very stale, very kind of stuck over longer periods of time. And that's often accompanied by difficulties with functioning day to day. So all those symptoms that we would see initially in grief, they just remain the same. There's no progression, or that progression is very minimal. Or sometimes people would return to work, and they may seem on the surface as if they're doing okay. But actually, when you start looking at what they do to maintain their functioning, is actually they disconnect. They're able to function for those 8 hours in the day, and then they're completely unable to return to having new relationships, to socializing, to enjoying their life. And that's a sign that actually this hasn't been addressed enough, and that they need actually a bit more help with processing their loss.
And I think you're so right about all the different stages and all the different complexity. And sometimes I think when a person is immersed in all these sort of emotions and sensations sort
Yeah.
of whirling around them, I think maybe
Mm.
that's a time when I know you're going to talk a little bit more about resources that you've got,
Mm.
Monica, but
Yeah.
maybe that's a good time to actually seek some help and have a
Mm.
conversation with an expert like yourself, so that
Mm.
they can actually understand what stage they're at and whether
Yeah.
it's considered, oh, this is to be understandable where you level, or actually you probably
Mm.
do have some work that I can
Mm.
help you with to resolve that.
Absolutely. And the truth is that even if you don't feel like, there's something more complex going on, I think it's still good to talk to someone, whether it's a therapist or a very good friend who can take it, who understands grief on a personal level, or if whether it's a support group. Like, there are so many things you can do to facilitate this process. It's actually incredible how many things you can do to help yourself once you understand what your needs are. But you're absolutely right. I think having conversations and reflecting on how your grieving journey is unfolding is invaluable, because I mean, sadly, there are many people who stay in this frozen state of grief for many, many years.
Mm.
And there's often this quite unhelpful, or I find it quite problematic, belief in on social media and grief communities that tells you, well, don't rush it. It's going to take its course, and grief takes a long time. It's normal how you feel, and that is very true for majority of people in majority of situations. But for someone who's a bit stuck in their grief in this very dysfunctional way, this is a message that says, well, this is never going to end. You're going to feel like this forever, and you just have to deal with it. There's nothing no one can do to help you. And that is not true. There's actually a lot we can do to um, to make this experience not as hard as it is. And I think it's really quite incredible how much people can shift, how quickly they can shift in their relationships to their loss, if they've got the right environment, if they're supported enough, if they've got someone to talk to, if they've got friends and family that can talk about their loss, and they can integrate their grieving process into living, rather than shutting it down and feeling that there's something wrong with them. So yes, grief doesn't have to be that hard if we confront it head on, and if we've got enough support in place. And that these are the fundamentals in terms of getting the right level of support, getting the right environment to facilitate that grieving journey.
I think one of the benefit though of going to a therapist or a counselor is what a lot of people say to me is
Hmm.
they often feel guilty about sharing their feelings with their friends. And they
Yeah.
don't want to burden their friends. And I suppose there's a certain level where they do talk to their friends or family and they're
Mm.
supported. But sometimes there's things which are more complicated, like the feelings of anger
Yes.
or guilt, where they don't want to share. So they don't feel they can
Mm.
fully share. Whereas with a
Yes,
therapist, you can fully
you
share.
can.
Um, and
Mm.
and say things that you perhaps even don't want to say to a family member or friend
Absolutely.
as well. And then they feel less guilty about burdening them because I think what you're saying, sometimes you have to talk through so much and they're so worried about over talking and oversharing to people so that the person,
Mm.
tires of it as well. Whereas with a therapist, obviously they need to, that they're allowed to talk as much as they need to about whatever
Mm.
it is that is bothering them. I don't know what you think about that, Monica.
I absolutely agree with you that it's a very different experience. Having therapy, grief therapy, or grief related therapy is very different to talking to a friend. And as you said, it allows you to fully be confronted with whatever's coming up in you, whichever conflicting, difficult feelings you're having, especially when it comes to anger, rage, um, experiencing relief that someone died. I mean, that is such a difficult feeling to be confronted with. Um, and speaking of myself, especially if you think of it in a context of a prolonged illness, when, like in the case of my husband, who died after almost a year and a half of very intense, very painful treatment for cancer, well, actually, my first reaction was relief that he wasn't suffering, that I wasn't suffering, and that, I had a bit more freedom to think, to live. I didn't, because I was his carer 24 hours a day. And, you see, if you say that to someone who's not qualified, who doesn't have the capacity to understand, you might end up having a very negative reaction, thinking, what do you mean you're relieved that they died? How can you say that? Or they might be a bit shocked, or they don't know what to say. And that could be very difficult. It's not to say that we shouldn't be saying these things to people, but I think there's a bit of a situation that could potentially lead us to believe that there's something wrong with the way we feel. And there's not such a thing. There's not such a thing as wrong feeling. All feelings are absolutely valid, and there's a reason behind them. And exploring that is what is so fundamentally beneficial to us in psychological therapy, whichever form of therapy you embark on, but that allows you to just make room for those very conflicting, very complex feelings, because most relationships are very complex. I mean, I, it's just the nature of it.
Absolutely. And somebody like yourself who is very specific, who specializes in this area, because I think sometimes it's also really important to find somebody who is the right fit for you as well, because you don't want to go to
Yeah.
anybody who's perhaps not experienced or hasn't studied this or can't
Mm,
relate to your situation.
absolutely.
Because
Mm,
then it would never happen, but you wouldn't want a counselor or therapist to say something insensitive, which sort of you know doesn't
mm,
help the person as well. So I think there's a lot to be said about going to somebody like yourself who is very specialist and can actually determine and help the person to, like you say, decide whether it is like a frozen grief and there is something that a
mm.
trauma process that you can help them with, to actually enable them to grieve more fully. I think that makes a big difference.
Yeah, it does, absolutely. And, with the specific forms of therapy, maybe we can think a little bit about that now, because there are certain forms of therapy that could be particularly effective with those kind of frozen states, which, for me, as someone who has background in working with trauma, it just comes very naturally that I think about traumatic incidents in life and how people struggle with processing certain information. So things like EMDR, which is eye movement desensitization and reprocessing, is a form of talking therapy that allows you exactly this without even talking too much. You can actually go quite deep into those memories and process them very effectively, very quickly, I wouldn't say it's always very straightforward, but the capacity to get there is much greater with this type of difficulty than it is sometimes with a traditional form of therapy, where it might take a very long time for someone to be able to speak, because that's the effect of trauma sometimes, that our ability to verbalize is quite limited, and we struggle with it a lot. So it's just another way of looking at it. So once we address it in that particular way, it makes it much easier, I think, for our brain to be able to deal with what happened. Because if we're flooded by stress hormones, our frontal lobes, or those parts of the brain that are responsible for processing information, are not functioning on a normal level, which is why often people refer to having this brain fog when they're grieving. They can't remember things, and then they get really irritated with themselves. Why can't I think? Or is it a brain damage? Or what is this grief doing to me? But these are all kind of signs that we're just not back on track with our functioning, and it's likely to take some time, but it usually gets better. But there are also situations where it doesn't get better, and that's a sign that, well, after a period of time, if you haven't got better, you're still struggling with it, well, it's definitely a sign to seek support.
Yes, that's very good point, actually. And that's where you're saying is a person might not understand the difference between a normal grief process. Normal is not quite the right word, but
Yeah,
an understanding level and
adaptive. Yeah.
adaptive.
Mm.
And then where there
Mm.
is some sort of complex trauma, and what you're
Yeah.
saying, but with your assessment of that individual situation, you can help them to actually process that, which will
Yeah.
really alleviate some of the suffering that they're actually having, which they don't actually need to have because it's a trauma response, which can be processed, is what you're saying. So very, very good point. And I think you made a very good point that also there are sort of different types of therapies as well. You have like just the informal talking to your family and friends,
Mm.
somebody like yourself who deals with a whole range of grief problems. And then I think you have people like
Mm.
who are counselling. And could you tell us a little bit
Mm.
about the difference between the two? Because I think people can get very confused as to what it is they need or what they're looking for.
Mm. Mm. Yeah, so I think counseling is this more supportive form of talking therapy that helps people just process or talk freely about how they feel in relation to their loss. So when we're talking about an adaptive response to loss, actually speaking to a counselor can be very validating. It can help you, I suppose, reach that place of um, being more in touch with your feelings, but also being able to return to normal living activities a bit, maybe not quicker, but in a feeling more supported by the presence of someone else that you can share everything that you've got on your mind. So it's more kind of someone just being empathic and present and just kind of listening, actively listening. And that's what counseling, grief counseling, can help you with. And for most people, that probably is all right. If they're specialized in grief counseling, especially, that's even more important. And most counselors would actually work with those kind of less complex presentations. But I think when things get a bit more complex, especially if you're struggling, it's been a long time and you're struggling with sleep and you're ruminating and all these things that we've described before, and you can't shake it off, then it's probably a good idea to talk to a specialist therapist, or a clinical psychologist, or any form of maybe counseling psychologist who specializes in working with grief. And what I also think it's really important in some ways, and that kind of speaks from my own experiences, that I think I became a better therapist after I experienced the loss, because I think it made me much more humble and understanding, and a bit more, not, I didn't say more human, because I think I've always been quite humanistic. It was just part of my way of practicing, but much more I think, humble about this whole grieving journey. And I think I'm not saying that you can only see a therapist who've experienced a profound loss, but someone who has the capacity to work with this, and not everyone does. And that there's nothing right or, there's nothing wrong with that. It's just you want someone who would at the same time offer you that um, the empathy and understanding, but at the same time will be able to um, guide you through this process, especially when something more traumatic has taken place. So you don't just talk about whatever you perhaps want, but also addressing those more complex areas that need to be looked at, and kind of more specifically trauma related or grief related therapies will be focusing on those areas and will be helping you with those areas. So that's the advantage, that I think it's more specific, more specialist. That means that we know a bit more about what might potentially help. We obviously never know for sure, because everyone's individual, everyone's different, their needs are different, but you can kind of expect that there are certain areas that might be problematic, and I think that that can be just more effective on the whole.
And I think another quality that you
Mm.
have, Monica, and people come see you, it is the ability to, what we in therapy say, hold a person, so that the person actually
Mm.
does feel supported by you and actually knows that they can actually go through their traumatic story, and
Mm.
knows that you're there for them and you can kind of hold them through it as well. Because sometimes or another reason they can't speak is that if it's so
Yeah,
overwhelming, so tearful, or there's horrific moments in it, they don't want to tell anybody else because they don't want anybody else to be
exactly.
affected. But you are very specifically trained to actually deal with traumatic
Mm.
grief, and you would know how to respond and be able to respond to any areas where they feel are very difficult to speak about or
Mm.
talk about.
Mm.
That'd be fair.
Yeah. Yeah, I think it's something about not shying away from those difficult moments, those difficult feelings, and you need to have that capacity in you as a person and as a practitioner to just sit with this without, brushing it off or suggesting that they should be over it by now, or but actually at the same time helping them understand where they are a bit stuck and how to think about it. Maybe not how to think about it, that's not the right phrase, but how to address it in a empathic but also quite direct way. So we're not shying away from that, and I definitely don't shy away from that with my patients, because that's the best way how you can help someone. It's to be transparent, honest, and seeing them for who they are, rather than trying to avoid something that's uncomfortable or very difficult or very triggering. Because we all have our own losses as practitioners. We all been through different things. We're just human beings. But I hold that very strongly, that I also work on myself, and I kind of take time to understand myself, and I've had my own therapy, and that's probably one of the most important aspects, is that I've worked on myself, so I know what it's like to be on the other end.
Mm.
And I think that matters even more.
And just another point, I think, is
Mm.
people maybe because they're suffering so much in their grief process, they might not go to a therapist or consider the need to go to a therapist. Um,
Mm.
and I think your point is maybe if they see someone sooner, even if it is just to sort of understand a little bit
Yeah.
more about them, that actually that you can really help them through the process of grieving. Um,
Yes.
so they might even suffer less because, like you say, they wouldn't necessarily understand their
Absolutely.
grieving process or what stage they're at, but to actually know or have some sort of understanding, I think is very key to going to somebody um,
Yeah.
who is specialized like yourself. And Monica, I also know that you've developed some resources around to
Mm.
help people more with their grief process. Could you tell us a little bit more about that?
Sure. So I've developed the Grief MOT, which is a first aid course for grief. And the idea behind this is to help people understand what this grieving journey is about, what they can expect, but also give them an indication a little bit. So by completing the questionnaire, they get feedback, personalized feedback at the end that gives them some kind of indication whether they are more likely to be on this kind of complex end of the spectrum, whether they might need more professional help, or maybe whether they're at the very beginning of their journey and what to look out for. So it's kind of almost like a check-in point. You do the questionnaire. It only takes 3 minutes. You get your results. You get some information at the end about what to expect, what the grief looks like, to get some understanding of what's going on in your brain, what's going on in your body, in your mind, and also how to develop more resilient ways to grieve. So basically how to get the support they need. And after that, there are some kind of exercises that you can do to help you reflect over time. You can always come back to the grief MOT, take it again, and compare your results over time, whether things are changing, whether your intensity of your feelings is changing, whether your reactions are any different. So I think it's really important that anyone who's experienced any form of loss can take part in this program completely for free. It's, I suppose, my way of just helping anyone who's going through this grief journey to take that first step in understanding themselves, understanding in a very kind of gentle, non-pressurizing way, and learning how they can support their grieving journey. In other ways, it's a bit like, a first aid help for any kind of, condition. If you have a cut and you need to clean the wound and put a plaster on, it's not necessary to take the pain away, but just to kind of make sure that there's no infection in the wound. Because if there is an infection and you need to look at things and get more professional help, then you need to do that. But if you're tackling along and you're more kind of in the resilient category of grief and things are generally going well, you just learn a few different tips how to maybe stimulate that more resilient form, how to access different forms of support. And then after you complete the questionnaire, over a period of a month, you receive emails with some more information. So every few days you get some stories and resources you can utilize. So it's kind of like a journey through grief, where step by step you learn a little bit about how to regulate your body better, how to think about your grief, how to access better resources, just kind of have a better understanding of what grieving looks like. So I really hope that's going to help people who are a bit unsure, or just anyone really who's going through a grief journey. And then from there, they can decide if they want to see someone more specialist. Maybe they would be willing to attend a psychotherapy group for grief, which is another thing I also am a big fan of. And I also run my own therapy groups for grief, which are, incredibly important. I'm also planning to do a directory of therapists who I think are really in the right place to be working with grief, and they are qualified enough. They've got the right set of skills, and helping people who are on this grieving journey to find the right person to work with. So I think there's just so many different resources people can access through the website. I also run my own podcast, A Guide to Afterlife, and people can learn a lot from just listening to different episodes when I describe my own experiences of loss, but also invite guests who are very knowledgeable in this area and have their own lived experience of loss, and different things you can do, for example knitting or yoga, things that you can really kind of utilize in your day-to-day life to stimulate that more resilient grieving process without even knowing. You might be doing things that could already be implemented and used in this kind of more therapeutic way if you've got the right mindset, if you know why you're doing it, and you've got that kind of understanding. So listening sometimes to those podcasts is it's a bit like a light bulb moment. You can think, oh, maybe I could try this, or maybe that would help me. So it's about kind of engaging those more creative parts of our mind in exploring those different ways how we can grieve and live.
And what a wide range of resources that is, and so very helpful. I just want to check out the groups. Are they online groups?
So one of them is running face to face, and the other one is running online. So to make it more accessible, so one is based in Southeast London, and the other group is online, to make sure that it's available to a wide range of people. And again, the focus is more specifically. I mean, I'm actually running one group that's specifically for widows, and I'm also a beginning group that is more widely accessible for more traumatic forms of grief. So it's about sometimes combining more kind of individual sessions to kind of prepare someone, or sometimes process a bit of that difficult experience of loss. And then when they feel ready, they go into a group. And some people are ready to go to a psychotherapy group straight away. So it really depends on the person and what kind of. So I'm always kind of meeting people where they are in their grief journey and directing them into the right places in kind of thinking more holistically. So sometimes I would prescribe having a massage every week. Sometimes it's a lot of body work. So it would be yoga with someone who's, aware of how to work with grief and body. So there are different things we can do. It's not just talking therapy. And I think that's what I kind of want to highlight, that grief is much more than just therapy. It's the whole range of things we can do.
And just knowing those services are out there and the rich availability of resources is great. And
Mm.
just to check this out as well, Monica, do you offer online therapy as well? Is it face to face?
Yes.
You do offer.
I do offer online therapy. However, I would say with the caveat that for some people that might not be the best form of therapy. So I always take it very seriously and assess with them whether, especially if someone's been traumatized, and sometimes holding that space online might not be as effective as seeing someone face to face. So in those situations, I would actually recommend someone more local to them to see for at least for that kind of trauma related piece of work. And if they want to join maybe a group online, that's absolutely fine. But safety is my priority. So I always kind of advise people what's best for them, and what they need to do. And rather than, offering just wherever is available, you know.
Absolutely, and a
Mm.
very good point as well. And Monica, how do people get hold of you? How do they get hold of all these amazing resources that you have to offer?
Sure. So if you head to www.guidetoafterlife.com. That's the website that holds the podcast, the grief MOT, and all the other resources that you can read about. I've got a blog that also had some kind of things you can download and some exercises you can do at home. So most of these things are obviously free, and a big fan of developing that kind of strand of my service. So I'm hoping to have more workshops and, ways how people can engage and build a community around grief. So yes, so that's and also the podcast is available on every platform. So if you just Google A Guide to Afterlife on Spotify or Apple Podcasts or any other platform, you will get that as well. So yes, it's all about having conversations. For me, at least, it's so important that we have those conversations around grief and what grief is really, and how to access the support you need. So that's kind of a bit of a place that I really want to kind of highlight for people.
Absolutely. And all those notes will be available in the show notes for people to listen to this. And I think it's very nice, again, to have a therapist who's got the empathy
Mm,
and understanding the skills. But I think you made another point actually with the group work, actually knowing, like you say, a widow or widower would actually know that empathy of how somebody would have gone through something similar, not the same, but
yeah,
similar kind of thing, that can
absolutely.
really build a great rapport and empathy and
Yes.
understanding with other individuals as well. And so
Mm.
can see how that would work very well.
Absolutely. Yeah. So important.
The whole thing is so important, isn't it? And for the person
Mm.
to feel understood and supported throughout, you know, just such a difficult time in their lives as well, such a tragedy, and to know that there is support out there and there are things they can do
Mm.
and there are resources out there to help them is a great message of hope, isn't it? It's a great message of
This
hope.
indeed.
Mm.
Mm.
Okay. So, Monica, thank you so much for being a guest on my show. I so appreciate your wisdom and all the work you're doing. And I'm sure you're going to have a lot of people calling you or getting in contact with you because, again, I think it's such an important subject. So, thank you so much for being a guest.
Oh, thank you so much for having me. It's such a pleasure, and thank you for agreed to talk about this incredibly important and neglected subject. So, my pleasure.
And thank you, everybody, for listening.